Tonight we've got a very important subject, one that I think is one of the most exciting, maybe one of the most magical arenas of healthcare, one that I love immensely, and one that is awfully important. We're going to talk tonight on the subject of healing, how a person heals injuries, and we're going to focus in this evening on everything that happens in your arms, from a shoulder down to a fingertips, and in your legs, from a hip down to the tips of your toes. That means we're going to cover things like frozen shoulders, people who go, ah, and they can't get their arm to move up in the air. Tennis elbows and all the other elbow problems that don't come from tennis. Carpal tunnel syndrome and wrist injuries, people who do computers or who play instruments or do lots of things. Mechanics, they can find their wrists and hands screwed up in various ways, and it can become quite a nuisance, even a crippling situation. We're going to talk about people whose hips are like, ah, when they walk. People who injure their knees, skiing or in sports, sparring or what have you, and they damage a knee, and the surgeon goes, well, off to surgery with you. You know, he's got to start cutting parts out, he thinks. People who, when they go and move, their knees crack and crunch, or they can't do squats because it doesn't feel right to bend the knee. They can't do exercise. They can't get on a bicycle or run because their knees hurt them. We're going to talk about ankles. People who told him last night he should write a song called I Fought the Refrigerator and the Refrigerator Won. People who drop a refrigerator on their ankle and then find they can't walk. Or who step wrong and an ankle sprains. Or who twist an ankle or a foot and the foot's always hurting. Oh, doc, it's right back there by my heel. It's under the sole of my foot. It's right there in the arch. It's under there, the front of my foot, the ball of my foot where my toes go. It hurts every time I run. It hurts every time I step. And I'll tell you, in way of introduction of this whole subject, you go to school and you study healing. I'm a doctor of chiropractic. You have a lot of years of study. And you sort of get the opinion from the schools that they don't think these things are all that important. It's a foot, it's a hand, it's an arm. But I don't have that viewpoint at all. I have the viewpoint that this area of healing is so important, and I'll tell you why. A person hurts their knee, and now they can't run. And now they can't do sports. And now they can't do the things they like. You say, well, so they can't do the things they like. That's a drag, but you know, it's not the end of their life. It's not like they hurt their heart or something. And yet, we know that if you want to live a long, healthy life, what's one of the most essential things that is scientifically shown to keep you alive and well? Exercise. What's the number one thing that's going to prevent you of dying of a heart attack? Exercise. There's only two things that can prevent the number one killer in this country, which is heart attack and stroke, blood system disease, and that's exercise and nutrition. Those are the only two things that matter. It's not the drugs you take. It's not the name of the surgeons you know. It's exercise and nutrition. Now, if you can't exercise, what happens? The whole quality of your life changes. The whole length of your life changes. You might live 20 years shorter than you would live if you could walk, if you could run, if you could bicycle. So I don't look at a knee injury or a foot problem that becomes chronic and keeps a person from being active as some minor problem, because it may shorten the duration of their life substantially and the quality of their life considerably. You take just about any person. I have people, a lot of musicians. We have a worldwide reputation for fixing musicians' hands. People who come in here and they can't play their guitars or their violins or what have you. And these people are almost past crying. They're ready to jump from a tall bridge when they see their whole life, their whole purpose in life, already jumped on off a bridge before they even got there, when they can't use their hands anymore. Talk about depression. If the thing you love most in life you can't even do. So I don't look at a wrist or a hand injury for those people as being anything trivial, and neither do they, Because when we restore their hands to working again, are they a little bit thankful? God, they're blown away to be able to do what they love to do, what they make a living at doing, to be able to return to what they produce and enjoy and live for. And who amongst us would want to live without working hands? I mean, no matter what you do. I certainly couldn't do it as a chiropractor, but how many things could you do if you didn't have your hands working? So I look at this area of legs and knees and feet and hips, hands and elbows and shoulders and forearms, not as any trivial arena of health, but very important to how we live, how we produce. And just because most of us take things for granted that we have that are working, and most of us do, we don't think about something till it stops working, then all of a sudden, hey, if you're not digesting food, all of a sudden digestion becomes real interesting. Up till then, who thinks about digesting? You just eat, right? And just because doctors and most people don't think, oh, a hand or a foot wouldn't be all that important, that doesn't mean that any of us would really think that if it were our hand or our foot or our knee that had become damaged. So tonight, what we're going to cover with you are the most incredible, amazing breakthroughs in terms of how to fix these problems, how to find what's wrong, how to understand them, how to fix them. I'll go over with you how to prevent them, how to nutritionally treat them, how to do first aid for them. We got a big agenda tonight because I'm going to try to cover everything that goes on in this area of sports and extremity injuries, everything that goes on with the hands and legs from soup to nuts tonight. We're going to look to cover the whole arena. Now, basically, problems that occur in these areas called the extremities, which is the arms and the legs, can occur in two different ways. There's two ways to get into a problem. Fast or slow. Those are the two ways you can get into these problems. The fast way is an injury. An injury where you have trauma, force, something goes wrong, you drop a refrigerator on your foot, a washing machine on your foot, you trip, you fall downstairs. The other day when your shoulder was torn up and you took a fall, they set a trap for you at the Veterans Administration and you took a fall. And they got him. They caught him. They didn't get to keep him and skin him though. But anyhow, they did get him.
I don't know about that.
You know, and the medical doctors looked at him the day it happened and went, oh, he's got to go to surgery. He's got a rotator cuff tear. That's what I like to call these shoulder things. Oh, well, what do you do for a rotator cuff tear? By the way, that's just a buzzword in medicine usually for like, your shoulder hurts. So you go in and you say, Doc, my shoulder hurts. And they go, rotator cuff tear. See, and if you say my hip hurts, they go, oh, bursitis. You know, and if you say my spine hurts, they go, oh, arthritis. They have these little buzzwords. They like to kick them out, and it makes them sound like they know something about what's wrong with you. And many times they don't know anything more than what you know. Sometimes they know a lot less than what you know. I mean, all they know is that your shoulder hurts. But boy, rotator cuff tear, you better go to surgery. That's what they were telling Steve. And yet we did the work I'm going to show you tonight on how you test a shoulder and fix a shoulder. And what happened 2 days later?
I was playing ball.
Playing baseball. He went to a baseball game. Playing.
Doctor, you didn't mention the torn cartilage in my left knee.
Oh, gee, I better mention that.
I couldn't.
Maybe you'll mention it for me.
Yeah. That was worse because that was very painful.
Very painful. We're going to go through knee cartilages because everybody knows you have to operate on a torn knee cartilage. And tonight I'm going to show you why that's rarely ever true and how you heal them up. Did you want to ask something?
We're going to deal with chondromalacia patella. You know what that is?
Which one?
Chondromalacia patella.
Chondromalacia? You're thinking of chondromalacia.
No, that's
Chondromalacia. It's not in the mainstream of what we're going to cover tonight, but after the talk, let me talk with you about that specifically, because it's not what most people are going to be curious about here tonight. What they are going to be curious about are the main and common things that can occur to any one of us, and I'm going to go through those in detail tonight. So you got fast injuries. What's an injury? It's where you get enough force onto one of these parts of the body that it overpowers the tissue. And something gave. Something had to give. And before we're done with much, we're going to know what it is that gives when you end up with trauma to one of these areas of the body. The slow way, people didn't used to give much attention to this, but now it's got its own names. Cumulative trauma is one way that this is described in words. Repetitive stress injury is another set of words that are used for the slow way of hurting an extremity. And these ways and these words have become more well known in recent years, because it used to be when the person was hurt on the job and there was a workers' compensation case, it was because somebody lifted wrong and they hurt their back, or they were in a fall and they hurt their back. And then came to be the age of typewriters and computers and so forth, and rivaling low back cases, and in some cases there are more instances of these. You've got people with like hand problems, this carpal tunnel syndrome kind of thing. I'll explain to you what that is tonight, where the wrists and hands get screwed up. And they didn't come from a sudden instant in time. This injury, happened at 12:56 p.m. and 10 seconds. I mean, at one moment in time, a person has a trauma. At an exact moment. It happens. But this one doesn't happen at an exact moment. It happened over months or years of doing stuff over and over, and then the person notices, God, my hands are killing me, and I got this numb little finger, and my wrist is hurting, and I'm sore up into the forearms, and it's all getting worse, and now I'm wearing this splint, and they're sending me to doctors, and they're telling me to take these drugs and wear these braces, and da-da-da-da, and none of it's getting better. Can you generate a problem like this by repetitively misusing or abusing an area? You can. A lot of times what we find is that there were underlying problems that nobody paid much attention to, and then a person tries to use an area a lot on an area that was already messed up and healed up wrong, and that's where this repetitive stress stuff comes about, because someone else can do that same sort of thing and not have a problem. Why is it one person does and another doesn't? Well, usually because the person that does have a problem has a weakness there. And before we're done, I'm going to show you where those weaknesses can come from. Can they even come from the way you eat? Yeah. From how you stress? Yeah. Those are factors that can affect how a person's going to respond to 8 hours of sitting at a computer. Very definitely. Well, before we go into what gets damaged, let's go into what there is to talk about here. What are these areas of the arms and the legs made up of? What are they built of? Well, on the most innermost part of them, you got the bones, the hard stuff. That's inside. Right? Here's a leg. Bones of one anyhow. Model of one. You got a hip, one of these ball and socket joints that lets you move it all different ways. The body likes to use those kind of joints when you get all kinds of directions to move things. And then you travel down the hip, you got a long bone of the thigh. And as you know from the song, the thigh bone's connected to the knee bone. Then you got a thigh bone, you got a lower leg bone attaching to that thigh bone at the knee joint. The knee joint isn't a ball and socket joint. It's very much a hinge joint. It lets you go this and it lets you go that. It bends and it straightens. It doesn't give you a lot of rotation. In fact, before we're done, you'll see what happens if you get a lot of rotation into it. You got trouble if you get rotation into it. Down the outside of the leg, you got this smaller bone, or fibula bone. This one's called the femur. That's the thigh bone. This one's called the tibia. That's the lower leg bone. Then you got this little fibula bone runs along the outside. And then you attach up to a bunch of these little guys that make up the tarsal bones, that make up the foot and the ankle joint. Then you come into these long guys that come down inside the foot. They're called the metatarsals. Rather important. I took a person today and she goes, oh, God, I've had so much pain in here. And I moved one of these metatarsal bones. She goes, that's why I call you magic hands. She goes dancing out when we move those things back where they belong. And then you come back down to these little ones that stack up and become your toe bones. That's a leg. Here's an arm. You'll notice some similarities. You got a ball and socket joint at the top of your shoulder. Lets you do all this stuff again. Goes all which ways. Come down a long bone of your upper arm. You come down to an elbow. It's not just a true hinge here because the bone on the outside, just like that little bone on the outside of the leg, has a rather special design. It's got this round head. In fact, this bone's called radius. The bone is called the radius. And it's got this round head with a strap around it that straps it down. And that round head is designed to rotate under that strap. Well, that's how you can do all this. That's how you can twist the lid off a jar and rotate your arm, is that radial bone rotates underneath that strap and lets you get all this rotation in the arm that you don't have in the leg. But you do have two bones that come down just like we had in the leg, and then it comes down to a set of bones that make up inside the hand and join to the wrist. Here they're called carpals. There they were called tarsals. Then you got a bunch of long bones inside the hand. Here they're called metacarpals. There they were called metatarsals. And then you come down to all the finger bones, similarly laid out to the foot. You can see there's a lot of similarity in the design of these two things. And in fact, go to a Museum of Natural History and you'll see this design's been popular for quite a few millions of years with a lot of living things. Been around a while. So those are the bones. Where two bones come together, we have something called a joint. You got one bone coming together next to another bone. We call that a joint. Most joints in the body are made for what? Motion. Movement is what they're all about. They're made for movement. That's why you have a bone comes together with another bone. What is it that defines that movement? Where can you move? Where can't you move? Because you can't go anywhere with these joints. I mean, you can bring your heel to your butt if you're relatively flexible. That's as far as it'll go. You can't just keep bringing it around, right? And you can bring a knee back to straight, but you can't keep going past straight. And why is that? It has to do with what holds bones to bone, a tissue in the human body called ligament. Ligaments. Ligament is made up of a type of material the human body likes to use a lot. It's called white fiber connective tissue. The human body loves to use white fiber connective tissue for certain things when it wants to connect something to something else. White fiber connective tissue is sort of the nylon thread, the nylon webbing that holds things together. In this case, when it's used to build ligaments, a ligament will have white fiber tissue anchored to one bone, anchored to another bone. And that, it is flexible, sort of like nylon webbing. It'll bend. It won't stretch much. You can't take nylon webbing and just stretch it. It won't stretch much. But it does bend and flex. And because it's attached in very specific ways from one bone to the next, it defines where bones are allowed to go and where they can't go no more. So you can bring an elbow to here, and then the ligament that goes from there to there goes tight. And as soon as it's tight, you can't keep going. It won't keep going around. And you can bring an elbow from there to there, and it'll go straight. And then the ligament that goes from here to here across this joint goes tight. And you can't keep going past straight, or something would have to give. What would that something be? The ligament, right? If you kept forcing these joints past the designed range of motion that a ligament allows them to go to, and you kept them going even farther than that, something would have to give. Well, the something that gives is the ligament. That is what gives in most of these injuries. When you drop something on your foot, twist your ankle, play drums so hard you injure your elbow, tear up a shoulder, fall and land incorrectly, any one of a number of ways, and you force a joint past where it can go, the thing that's going to go most of the time isn't the bone. It doesn't snap. The ligaments are more fragile than the bone, and they have to give. Luckily, most of the time, ligaments just don't rip apart. They don't just tear in half. They don't just tear themselves off. That doesn't happen most of the time. It can happen some of the time. But most of the time what happens, so many more frequently that you would call tearing a ligament right off quite rare, what happens instead is we cause what we call micro-tearing of ligaments. They go. Now these are living cells that make up these fibers of white material. If you've eaten meat and you've looked at chicken or you've looked at beef and you've seen what's around the bones, all that white stuff is ligament. Right? You've seen it, most of you. And when you force that joint to go too far, it doesn't just usually rip it right off. You'd have to tear your arm completely out, and then you'd have to tear the ligaments off if you did that. But when you twist a knee too far, or you force a wrist back too far, or you injure one of these joints, most of the time you micro-tear these ligaments. That means the cells inside tear, some of them, and they spill their cellular contents. All the gook inside of them spills out, and that causes swelling, and your body has to dilute it and try to get rid of all that protein and garbage that just came from that cell being torn. But you usually don't just tear it right off. It's not that you usually just rip right through it. When you do, it's a more serious problem, but that doesn't happen most of the time. Most of the time, we micro-tear those ligaments, and they become overstretched, and the bone's moved into the wrong position, and now they're sitting in the wrong position. And the ligament's been stretched and micro-torn inside to where it doesn't hold it in the right position, because now it's sitting in the wrong position where it tore to. You understand what I'm saying? There's a word for that. Most of us have used the word but don't know what it means. That word is sprain. A sprain is when you force bones into the wrong position and micro-tear the ligaments. That is a sprain. It has a technical meaning. You probably heard the word strain. That also has a technical meaning. That's when you tear muscle cells, which is not near as common, by the way. Muscles are gushy and flexible, and you don't usually tear muscles all that often. But we do tear ligaments with great frequency. Nearly every one of us has torn some ligaments at some time in our lives. Now, I don't know how it was for you, but I suspect it was similar to the way it was for me. When I was a kid, we thought this way. If you broke a bone, big deal. If you had a sprain, no big deal. Isn't that the way you thought about it? Isn't that the way it was explained to you? Fracture, broken bone, big deal. Sprain, no big deal. You don't have to think about it. Fracture, broken bone. Let's break a bone here. Big deal. Why? Oh, you get a cast, everybody would sign it. You know, you could see it on the x-ray. Big deal. Let me tell you something interesting. It takes the human body 5 to 6 weeks to heal a broken bone, as long as the parts sit where they belong next to each other, in relatively the right position, and you have reasonably decent nutrition so that there's at least some minerals so that your body can build a cloud of minerals around this, which is the way it starts, and then condense that cloud down, and then re-weld these bones back together again. And then, let's say nobody even bothered setting it very well, and they were sitting like this when they put the cast around you. And don't think that doesn't happen all the time, by the way. And then your body heals it like this. And oddly enough, your body will, over the coming year, act like a body shop mechanic and sand it down and smooth it out and re-sculpt it and make it look as close to nice, smooth sculpture as it can. It does that just with flows of energy and time. And life does that. Life does that. By the way, one thing that is true is that in this era of medicine, as doctors became less and less skilled in using their hands and touching people, and they began to work across desks and just take blood and send it to the lab, and you didn't really, became very antiseptic, modern medicine, and you don't really have much contact with the patient, and the old skills of a good family doctor who knew how you smell and how you look and how you touch, those skills sort of got in short supply with many doctors. Doctors don't always set bones very well. In fact, they're more worried about malpractice if they touch you than to leave it where it is and not. Now, this is sort of interesting because if you come here and you think you've got something damaged and we shoot an x-ray and we see a fracture, and we catch fractures all the time. We have people that go to the good hospitals. We had a guy last year come out of Cedars-Sinai Hospital. They told him he had 1 fractured rib. He had 5. They missed 4 of them on the x-ray at the emergency room. Didn't see them. Didn't know how to treat them. Missed the biggest ones, actually, interestingly enough. But we shoot an x-ray and we see a fracture. I had one of my associates that he loved to ride motorcycles. He went down on a motorcycle one day. He fractured his wrist. We shot an x-ray. Hey, Stan, you better go get your wrist fixed up. Now, technically, the only kind of person who can put a cast on in this society by law is an orthopedist or a doctor, a medical doctor. So we sent him to a very good orthopedist. And he took the x-rays that we had taken, and he went in there, and he put the guy in a cast, and he sent him back to us. And I said to him what I'll say to you if I see 2 bones sitting like this, and they're not lined up very well. I said, okay, let's shoot a picture through that cast and see how he did. He didn't put the bones straight at all. You're going back, Stan. We sent him back to the orthopedist. He came back again. I shot another x-ray to quality control, quality check what the orthopedist had done. He hadn't said it again. We sent him back a 3rd time. Now, for them, it's a bit of malpractice and hassle to mess with you, so just let it heal. But this guy was a chiropractor. Do you really think he wanted to have a bent thumb and a bent wrist for the rest of his life? No way. I just sent him back to that orthopedist 3 times to get it done once right. Now, that's something most of you don't realize is a function that we have here, but that's one reason when you come to these seminars, you learn things that someday may be the thing you really needed to learn, which is we act as quality control over this kind of medical work when you think the guy already did a good job. But let me tell you a secret. 6 weeks later, when that thing's welded up wrong, guess what your options are? Live with it or go into surgery and break it again. Those are your only 2 options. You only get the chance to set the thing right the first time before it heals. Because once it's healed wrong, you're either going to live with it wrong or go into surgery, re-break it, and set it again. And then they go, oh, let's use some screws and plates, and they get into all this crazy stuff. Oh, I got to have you grab something for me. Well, not you. You're not running that fast. How about you, Randy? Scoot around there, and you'll see a little like Tupperware thing on my desk. I want you to bring me some very interesting hardware that was just handed to me about 2 hours ago. Came out of a woman's spine. See, what they like to do with some of these things is they'll get all these expensive screws and bolts. They put this in a 23-year-old woman's spine, and they only charged her $70,000 to do this. She came in here in agonizing pain. She left here out of pain today. And they've been treating her with therapy since the surgery, since last year. The therapist couldn't get her out of pain like we did in 5 minutes, really. And I'll show you the technique that enables us to do that. So you've got ligaments. They form a use of this white fiber connective tissue. They're very, very important in terms of holding joints together, and they're very, very important in terms of injuries, because when a problem has occurred, one of the major things we have to look for is where are those bones sitting and which of those ligaments are now sitting in the wrong length, allowing the bones to be where they don't belong, or allowing slop or play into that joint where it wasn't designed to be. You have another application of white fiber tissue. The body likes to use it in many ways. In the knee, for instance, you get a pad on the inside and a pad on the outside between the 2 leg bones, made up of white fiber tissue. But in this case, when it forms a pad between the bones, it gets a different name. Now it's called a cartilage. Not a ligament, but a cartilage. A ligament, you got binding between bone to bone. Now you got a pad that sits between the bones so that every time you take a step, you don't have your knees going grind, and you're not a little puddle of like bone dust at the end of the day, because there are these cartilage pads that sit one here and one there. Now in a knee injury, when I fell skiing years ago, and you got this big old ski on the end of your leg, and a ski represents a big lever. And you know what leverage is good for in the physical universe? Multiplying force is what it's good for. You want to lift something really heavy that you can't even lift? Get a lever and get out on the end of it. Put a rock over there and get on the end of that 2x4 and then push. And you can lift a lot of stuff. Well, you apply force to 4 feet of wood and steel that is fastened to the bottom of your foot. You can add a lot of leverage in a direction that the knee has ligaments going here and here and here and here, and even crisscross ones inside. It's made with a special design where you got these ones called the cruciates that crisscross inside and attach inside. Then you got the 2 pads called the meniscus cartilages. So you got a lot of design into a knee because it's a major bone of getting around, major joint of getting around. It carries your weight. It does a lot of work. And it's carefully designed with a whole series of ligaments. Well, when you cause that kind of twist, what happens? Well, for one thing, the ligament from here to here was just lengthened. So what did it do? Microtore, right? And what happens to this cartilage pad that's glued in there that's supposed to be sitting in the right place? It gets spit out, and it gets tears in it. How many of you have been told or believe that you can't heal ligaments? Any of you? How many have been told that you can't heal cartilages? You guys haven't heard these things, but you have. Yeah, it's a very common myth that the human body can't heal a cartilage. Doctors really believe that. They go, oh, you can't heal a cartilage. They're convinced you can't. That most of them are, for some strange reason, even convinced that you can't heal ligaments, but they're fully convinced you can't heal cartilages. Now let me tell you why that is truly and absolutely false. White fiber connective tissue turns out to be the cheapest tissue in the human body. It is the easiest tissue for the human body to make. In fact, if you tear something in your body, you cut something in your body, and your body doesn't have the luxury of building beautiful new liver tissue or beautiful new tissue, what's the first thing it does to stick parts back together again? Scar tissue, right? Cut your finger, scar tissue. Kill off a liver with too much alcohol, and your body goes, I don't have the wherewithal to rebuild the liver with liver tissue. I'll just scar it up. I'll replace it with scar tissue and fat tissue. It does that. Takes the cheap stuff and jams it in there. White fiber tissue, connective tissue, is the cheapest and in many ways the dumbest tissue in the human body. Can't do anything fancy. Can't see, can't turn light into signals, can't filter blood like a kidney, can't, contract like a muscle. It's just sort of rope. It's the lowest level of living tissue you got. And so the body can build white fiber tissue. It does it all the time. It's always in the business of building white fiber tissue. So when you tear ligaments or you tear cartilages, yeah, the body can put white fiber tissue back. The reason that doctors are such pessimists on this subject is they don't understand what needs to happen so that joint in your body will work right again. Oh, it'll heal. But it'll happily heal your knee just like that. If it's sitting like that, no, it doesn't have any choice. It'll heal those microtorn ligaments and just put them right back there. But now your knee isn't straight. And now that hinge isn't straight. Well, if you took a door here that's on hinges and you were able to bend it so it wasn't straight on its hinges. In California, it's a law that you have to believe that exercise can cure anything. That's a law in this state. So, people believe that if you have a knee injury, you need to go to physical therapy and exercise it an hour at a time, 5 days a week, and it'll be fine. Just get on those machines and keep going and going and going. And then they wonder why these people say, Doc, I'm hurting worse when I'm doing this exercise. This isn't working for me. Happens a lot. Well, what would happen if you took that door that was bent slightly off its hinges? Could you cure it by opening and closing it 20,000 times? No, you'd end up with a bunch of metal filings underneath the hinges at the end of the day that you'd have to sweep up from them grinding on each other. And when you've got a knee that isn't straight and the cartilage is moved out and you're grinding away on that cartilage and that knee isn't straight, of course it hurts and it doesn't get well. And yes, the body's done its best job of healing it. It healed it just where it sat. But until somebody can detect that it's sitting like this and not like that, that it's twisted and not straight, and then straighten it out, which I'll show you how we do that. They don't do that in medicine. Do you know they don't even look for it, test for it, figure it out, or do anything about that? They've got no awareness of it. They have no technology for it. It doesn't exist in medicine. It is totally non-existent as a consideration. So when they can't find it or fix it, of course it just heals the way it is. And we know that when a joint heals incorrectly, where it's now out of position, a series of things occur. But one of them that occurs is this. Joint degeneration occurs. And over a period of years, that joint starts to wear out that tissue, that cartilage starts to shrink and die, and the body starts putting these weird calcium deposits, hooks that look like coat hangers and junk, building into the joint until the joint is all crudted up. And in medicine, this is all just the mystical, unavoidable future track that we all face for some reason. It's just mystifyingly what we must all go through, you know. Oh, well, joint got hurt, you can't heal it, you know, take the drugs, When it gets finally bad enough, we'll give you a knee replacement. And we'll put in a plastic one. That's how it goes. We'll get good replacement parts for you, but we got to wait till it gets worse. It's not quite bad enough yet. You think I'm making it up?
That's true.
I'm not making it up.
That's true.
That's how it really is. Oh, it's not bad enough yet for us to hack that thing out and replace it with some Terminator 2 parts, you know. Not quite bad enough yet. Give it another 5 years. What makes up the huge mass of a leg or an arm? It's not the bones, it's not the ligaments, it's not the cartilage. The big mass of these things is what? It's a muscle. Boy, you take a look at a leg. These bones are the size of my leg bones, but they aren't the size of my leg. What's all this stuff? Muscles. The big mass of a leg or an arm is the red muscular component. And muscles are allowed to create the movement as they contract. You got a muscle that goes across this joint. And then that muscle has to be anchored to the other bone, glued to it, as it were. So that you got a muscle that comes from here, your biceps, and fastens down here. And when you contract that biceps, it pulls your arm over. And you contract the triceps, which fastens here, and it goes. When the human body wants to attach a muscle to bone, it goes back to white fiber connective tissue. Gets another name now. It's not a ligament this time, it's not a cartilage, this time it's a tendon. Take white fiber tissue and use it to anchor muscle to bone, and now you got a tendon. Another application, same basic material, building material. By the way, if you wanted to speed the healing of ligaments and cartilages that were damaged, could you do anything to speed it up?
Yes.
Sure you could. If you were a medical doctor, could you? Probably not. Why? Because nutrition, the N word, is a dirty word to most medical doctors. They don't know anything about nutrition, never learned anything about it, think it's total nonsense, don't believe in it. It's like some kind of religion they just can't relate to. Everybody else in society has figured out nutrition is important to health, and medicine will figure it out 30 years after all of us got there. Give them an extra 30. Maybe they'll get there. Maybe. Because they got a better idea. Drugs. Much better than nutrition. If you get everybody on drugs, you'd finally really be able to cure everybody, right? Could you speed the healing of ligaments and cartilage? Yes. With nutrition? Absolutely. Why? If you superpowered into the bloodstream all the raw materials that the human body used to repair ligaments and cartilages, and then you line things up so that the body now had the correct length and position of everything, and now it had the job of re-welding and re-correcting these things, and all the material it needed were in the bloodstream in abundance, could it heal much faster?
Absolutely.
Oh, yeah. Now, Pepper's an interesting case. He didn't have a ligament injury, but it was, what, 3 weeks ago that you were pronounced to be blind for the rest of your life in one eye, partially blind?
June 21st.
June 21. So it's not been a month.
Yeah.
And they told him he had damage to the retina.
Said it was a dead retina.
Dead retina.
Said it can't be repaired.
Choked out in kung fu. Dead retina. Couldn't possibly be repaired. He'd just have to live with being partially blind in that eye the rest of his life. Just see a big black hole, was it? Right in the center?
Yeah.
Nice big black hole where you would normally see things. How long did it take for us to get 90% of your vision restored?
About a week.
1 week. Where's it at today?
The spot is like really tiny. It's like it's clear. I can see through it. It's every day it gets better.
Yeah.
You know,
It's not even been a month. They told him the rest of his life that couldn't heal. Want to know something about ophthalmologists and eye specialists who know all about eyes who can't heal? They also don't know anything about nutrition. Nothing. Nothing. If you had a damaged retina, you couldn't ask an ophthalmologist to tell you about nutrition to heal it. So why did Pepper come to me? Well, one of the reasons is because we do nutrition. And when we had to heal his carpal tunnel, how many years ago did you come in here with carpal tunnel? Very great guitarist, Pepper.
How about like maybe 4 years ago?
4 years ago. And medical doctors don't heal carpal tunnel, they operate. They do surgery. They got to cut you to fix a wrist like his. We didn't have to cut you to fix your wrist. And we didn't have to have him live with a blind eye the rest of his life. But let me tell you, nutrition is a key to healing many things. And will outclass drugs in so many instances that you'll often hear me say nutrition is the first line of medicine. Drugs is the long way behind back line of health care for most things that you could, if you knew what you were doing and you wanted to do the right thing. Now, when they found you had diabetes, did they expect we were going to get your blood sugar down to 100 by dealing with your nutrition? No. That you'd be normal and they wouldn't even be able to detect your diabetes in your blood? And how long did it take? A week?
Less than a week.
Less than a week. But that's nutrition. But with diabetics, you have to give them drugs for the rest of their lives. When your friend Joe, who sent you to me after you dropped this thing on your leg, and they told you, Joe, he had diabetes, and he was going to have to take insulin the rest of his life, but now he doesn't take any because his blood sugar is normal. You do that with nutrition, and you do it with chiropractic. You can't do that with drugs. You can only manage people. That's what they call it, management. You can manage people's diseases with drugs, and you get to manage them forever and keep selling them lots of drugs. And they're ongoing repeat buyers because they don't get off of those medications. So when we want to heal ligaments and cartilage, we can use products like this, Ligaplex. A lot of you guys take Ligaplex. I take Ligaplex. I take it preventatively. We'll touch on that before we're done tonight. I've taken it when I've injured things. Why? It puts into your bloodstream what you need to heal torn white fiber connective tissue. It's the raw material of repairing that stuff faster. You want to know something interesting? Come to me with a fracture and let me put you on bone healing nutrients. Something, I don't see it here, but it comes in a silver bottle like this called calapatite. Put a person on some bone healing nutrients that has fractured bones, and guess what? It won't take 6 weeks for those bones to mend. It'll take 3.5. And every time the doctors look at those x-rays and they go, boy, you're healing way ahead of schedule. I've never seen anybody heal this fast. And if the patient says, oh, well, I'm taking nutrients, they just chuckle. When you told the ophthalmologist that your eye had healed and he can't even find the injury in his retina anymore, and what'd you tell him?
I got pissed off.
Because he laughed. He told him he was taking nutrients, saw the chiropractor, and the ophthalmologist laughed. Ha, ha, ha. So funny. Chiropractor, ha, ha. Nutrients, ha, ha. Eyes, like that could do anything. Ha, ha. They think it's hilarious. So outrageous to them. They can't even think with this idea. To them, it's just like a cartoon.
They're so smug.
Oh, yeah, it couldn't possibly be that anybody could help them with nutrition. Absolutely. They're scientists. They know so much better. Hey, you want to know something very interesting? There are nutritional papers published in the New England Journal of Medicine and in doctors' journals every month. It's shocking how much nutritional information goes to these guys, and they don't apply any of it. It just... They did a study why doctors don't apply nutrition, and they found this. A, they don't really study it, and B, they have no role models as nutritionists to pattern their careers after. And since they have no one to aspire to be like who is a great nutritionist, because all great doctors are great with a prescription pad or great with a scalpel. That's a great doctor. But there are not great doctors that they aspire to be like that are nutritionists. How do you think I got to be a nutritionist? I aspired to be like a great man I know, Dr. Jensen, who was a great nutritionist. And how many people have gone to chiropractic school to learn to be chiropractors and nutritionists? Been my patients. Dozens and dozens. Why do you think they do it? Because they got someone to pattern their career after who inspires them. But who inspires a medical doctor? Somebody in the hospital who showed them how to do their surgeries and showed them how to write a prescription and how to have a nice bedside manner.
Your bank account tells them to do the right thing.
Yeah. Well, it used to. It used to, until my medical doctor went to his continuing education licensing seminar in the state of California a few weeks ago, and they told him that doctors are losing their patients to all of us alternative
Yes.
practitioners.
Yes.
It's the way it should be. It's the way it's going to be. What happens in hands and arms? When people hurt their hands and arms, the symptoms that they develop is they develop pain, they can develop numbness, they can develop weakness, they can develop lack of control, they can arise where they can't get fine-tuning control of things, they don't have the speed of control or accuracy. I deal a lot with musicians, and these are things they're worried about. They got pain, they got numbness, they got weakness, they don't have speed, they don't have control. These are the things that go wrong. And when you think about those, pain, numbness, weakness, lack of control, lack of speed, and some of you have been to these other seminars in the series, what system of the human body governs things like pain, or you can't feel it, numbness?
Nervous system.
Nerves. Lack of control of muscles. But nerves. I can't make things go fast and where I want them to and have fine control of them. Nerves. What are you dealing with? Nerves. Now, how is it that this stuff, a joint that's sprained and damaged and the ligaments are torn, ends up having these symptoms of failing nerves? And in my experience, here's the answer. You have the hardware we've been talking about, and then you got the software. Oh yeah, you got bones, and you got ligaments, and you got tendons, and you got cartilage, you got muscles, you got all that hardware in there. And you can tweak it and jam it and malposition it. But one thing we know is that nerves supply all of these joints in huge amount. 1 out of every 15 of the 1 trillion cells that make up a single human body. 1 out of every 15 of your 1 trillion cells is a nerve cell. That's billions of them. And their sole job is the transmission of information, the communication of information. They are the communication lines and the computer system, the telephone switchboard and the wiring diagram for everything that goes on in the human body. There's a reason 1 out of every 15 of your cells carries electrical information. And that's all they do for a living. Well, it turns out between these joints, inside the joints, inside the muscles, going to the muscles, coming from the ligaments, coming from the tendons, nerves are in all of these, richly supplied, millions of them. And they're mainly hooked up to a system called the proprioceptive system. And you'll hear me talk about tonight proprioceptive technique. What's proprioception? It is that nerve communication that does a number of things for us. For one thing, it tells you where you are in space. So when you're sitting there, you're sitting there, you're sitting there, it tells you where your arm is, where your knee is, what position your foot is in, where your head is right now. Are you tilted? Are you here? Are you there? All that feedback information from your joints, muscles, is all coming up to the brain and being mapped and letting you map where you are right now. That's proprioception. If you look it up in the dictionary, they'll tell you that's one of its key functions. And proprioception, we now know, is an underrated system. Scientists are learning more about it all the time, but they don't know what I know about it that I'm going to teach you tonight, most of them. But what they're learning is that this is the system that enables all fine control of everything you do in terms of movement and control. All muscle control. You can't write a letter. You couldn't possibly solder a wire, work a computer, play an instrument, kick a ball. You can't even stand up without proprioception, giving feedback between all these tissues in your brain and your brain giving feedback back to it and giving all. I mean, you take a look, you stand on one leg and you go, God, I'm just going to tell myself, stand on one leg. Look at all the stuff going on here for me to stand on one leg. And I'm just thinking, I'm just going to stand on one leg. But I got this proprioceptive system sending gajillions of signals back and forth so I can just stand here and talk to you like this for a minute. Right? Very, very important that when the hardware becomes screwed up and deranged, it begins to affect the software. And there starts becoming noise in the software system. And that noise is failure. That noise can be pain. If that noise becomes enough compression and damage, it will be numbness. And it will cause lack of control. And then muscles go weak. When I test things, you're going to see us test for weak muscles. Why can we find problems by finding weak muscles? Because of proprioception. See, when there's a screw up on these circuit boards in the software, what we see is failure in different ways. And one of the failures is you can't control those muscles the way you used to. Oh yeah, they used to be at 100% that you could use this hamstring in your leg, but now it's 20% strong. And you know what? You don't even fully know it. Your body's such a smart poker player, it's always trying to figure out how to play the best job with the hand you dealt it. I had a patient come in here and I used proprioceptive technique, and she comes in, she's got this giant cyst on her ovary. It's the size of a baseball. It's dissolved now. Of course, they had to do surgery. They had to take out her ovary, they thought. But I told her, no, we dissolve ovarian cysts over and over again. I've never missed once. Don't intend to miss with you, even though yours is the biggest we've ever seen, and yours was all infected and full of goop and pus and all screwy and had bacteria eating away at your ovary because it got so big and stupid. But I think we'll even fix yours. And sure enough, I went and tested the nerves to her ovaries, which happened to come from her low back. I'm testing her leg muscles. She's got no leg strength. No leg strength. I said, do you realize you have no leg strength? No. I get a little tired when I go hiking. I said, well, look at this hamstring. Bang, it just drops like a bomb. Look at this hamstring. Bang. She doesn't know. She's out there hiking. She gets tired. Hey, nothing's wrong. I just get tired. When we go and fix her back, which corrects the software, which took the errors out of the nerve system, which restored her hamstrings to strong, which brought the nerve signals back to her ovaries, which was one of the things I had to use with nutrition to repair her ovarian cyst so that the surgeons could now look at her and go, well, I guess we don't get to cut you because you're better. What happened? Her legs went strong because we corrected the nerves. By doing what? Fixing the joints. See, here's what happens. When you fix the joints and you realign things and now everything sits where it belongs, a very interesting and wonderful thing occurs. The noise on these nerve networks that's like snow on the screen, garbled up signals, starts to clear up. All of a sudden the muscle strength starts to come in. You come in, you can't move the arm, and I test and I say, resist me. It goes bang. And I make a correction using our proprioceptive chiropractic technique. They don't even teach it in the colleges. I had to import it from the developer up in Canada, third generation bone setters to the Tsars of Russia. And he cross-pollinated his work with a great researcher in chiropractic down here in Nebraska, and out of that came a technique most people never even heard of in chiropractic or anywhere. The same one I did on your foot. You say, geez, in 2 treatments I've turned the corner on a foot you couldn't even use. In 1 treatment you suddenly start using the arm. This woman that they put all this stuff in her back, she played basketball, and at age 23 she's come out of $70,000 in surgery to have all these parts installed and then taken out of her back. And I made 1 proprioceptive adjustment and her hamstring strength went from 0 to a 10. Why? Straighten out the hardware, takes the pressure off the software. It's almost like the cable guy shows up and does the right thing, and he hooks the wires up again, and all of a sudden the picture's clear, and the brain's getting the signals, and the signals are going back to the leg, and then the muscles can go to strong. And guess what? Then you can start healing, because remember, a lot of the bulk of this is muscle. If you don't have the support of those muscles and they're all short-circuited out, you've lost a major support aspect of this. So by the time you've got the joints malfunctioning, the signals going wrong, the tissues are in the wrong place, and the muscles aren't getting any strength either, what's your chance of healing that? See, the doctors are right. These things don't heal. They're totally right. They don't heal. You can't heal this. It'll go on and on and on and get worse. They're so right. Because their limitations in what they can do, they assume is the limitation of what can be done. That's all they were taught. And after all, they are the gods of knowledge in this area. They must know it all. So it couldn't possibly heal, could it? Now, there is something very true about cartilage that's worth understanding. And it is one reason that doctors have a little justification in their pessimism. The cartilages in the human body are unique in one way. They are the only tissue that after the age of 18 does not receive a direct blood supply. In an adult, your cartilages do not receive a direct blood supply. Every other tissue in your body has capillaries and blood vessels that bring the groceries directly to the cells and carry the garbage directly away. Those trucks come right up and bring in the groceries and take away the waste. They have blood arriving directly to them. But cartilages, like you have in your knee, and by the way, these disc pads, the disc pads of your spine are cartilage. These are cartilage pads. Again, they sit between bones. Why? So that as you move bones around, you don't grind your spine. There's a pad in there. Cartilage. The discs of your spine do not receive a blood supply when you are an adult. Does that mean they heal faster or slower? They heal slower. Because they live like sponges. Cartilages live like a sponge. They have to have movement. They have to pump. Like most tissues in the human body, what makes up most of the tissue in your body? Water. Water. This stuff's all wet. And the cartilages of your knee and the cartilages that make up the discs of your spine, they have to be pumped by movement so that they can exchange, take in nutrition from the fluids around them and squeeze the waste out into the fluids around them. They live like sponges in the ocean. They heal slower. The truth is a cartilage heals much, much slower than a ligament. Now I told you to heal a broken bone takes how long? 6 weeks. Give it the right nutrition, shorten it dramatically. To heal a torn ligament, 12 weeks. To heal a shredded cartilage where you really ripped it badly, quite a while. Really for full healing, about 9 months. They really take time. Now, when I shredded my knee cartilage on a ski slope, they would have taken me instantly into surgery, as they would with you. They love these new arthroscopic surgeries. In the old days, they used to take a knife, hack out the cartilages, throw them in the trash, and put you back on the road. Duh! That's how they did it until, like, whatever that was, 12 years ago. They just hacked them out, opened it up, pulled the whole pad out, and threw it in the wastebasket. The usual thing to do for a bum knee. That's how it was done. No, they had no replacement parts. Now they have what's called arthroscopic surgery. They can drill little holes, stick in little TV cameras, and go in there with little whirring and clipping devices. They got little rotary saws and nippers and clippers, little stainless things. They go in the holes and they clip and snip and tear and cut. But you want to know something wild? They never detect that twist of the knee, and they never straighten it out. So the ligaments never heal properly, and the software often never recovers. And you meet people all the time who have been through these knee surgeries, and their knees still bug them. And what happened? Well, we did as well as we can do, the surgeon says. It's as good as it can get. Want to know something funny? We adjust them after knee surgery, and they get good. I've had 2 people that came to work for me that are on my staff because they were told they had to go into knee surgery. They hadn't been able to walk one good day in their lives, for one of them for a year. And I analyzed her with proprioceptive technique, made one adjustment to realign her knee. She walked out straight, never had pain again. Canceled the surgery, never had a problem again. We do that all the time. The cameraman that usually shoots here, he watched enough of these videos. He said, you know, the best thing is you not only pay me to shoot the videos, but I get to hear all your talks. He said, Doc, you know, I got this knee, I can't jump anymore. I made one adjustment to his knee. He went back to high jumping. Immediately started doing squats, something he couldn't do at all. Why? Because when your knee is crooked, it doesn't work right. But you can't see it on an x-ray. X-rays don't pick it up. And so the doctors can only find what's easy. The broken bones show up on the x-rays. The rest of it's all guesswork. Oh, it's a sprain, it's a rotator cuff, it's a tendinitis, it's a this. They don't know how to fix soft tissue. They're notoriously unable to understand the blueprint of what I've covered with you tonight, because they don't think it through from, if that's the cause, what would be the correction? If it didn't take a knife to screw yourself up, why would it always take a knife to straighten yourself out? I mean, you didn't take a knife to give yourself this knee problem or this wrist problem. Why would you have to go in there with a knife and hack away to get it right? It doesn't even make sense when you think about it. It doesn't work either. Now, in the wrist proper, you can, the common things that can go wrong. Why don't we do this? Let me do some testing now, and I'll show you some of the things. Is there anyone here who's got arm or leg problems that I haven't tested? Come on up. Let me volunteer here. A couple of you, come on up.
It's fine.
You okay? It will heal with all crisscross fibers if you immobilize a ligament tear. And then it acts like one of those Chinese finger traps. You stick your finger in and all those things, try to pull your finger out. See, it won't allow for movement when it heals like that. So you got to let a sprain heal with movement. And as it gets better and better, you do move it. Do you force it to move a lot in the beginning?
No.
That doesn't pay off, you see. Here's why that California law that exercise cures everything doesn't apply in the early part of a bad sprain, because if you try moving it after I put it back into position and you move it a lot, or try to lift weights or put a lot of force on it, what do? You take those overstretched microtorn ligaments and you force those bones back out of position again. You don't want to do that. You want to keep the bones dynamically in the right position with increasing movement as time goes on, and then the thing heals with strength, correct position, correct nerve transmission, and correct ability to have motion. If you immobilize these injuries, you screw them up. Do all doctors know this? No, many of them have completely misunderstood ideas on how to deal with soft tissue injuries, and they want to throw everybody in a brace and a splint. And you see these people, and they've been wearing these carpal tunnel splints for 2 years. How come their wrists aren't better? Because they're getting worse. Because they're immobilizing a soft tissue injury without identifying what it really is. Soft tissue includes ligaments and cartilage. That's what we call soft tissue. They're immobilizing a soft tissue injury. You don't do that to these sprains. You have to reposition them, dynamically let them restore themselves to movement, use the nutrition to speed the healing of the tissue, and then you can go to strengthening. Here's the correct sequence. Relief, correction, strengthening. 1, 2, 3. Relief, start lining things up. Now the proprioceptive signals start getting through. Strength starts returning to the muscles, not even because you're working them out. See, I took this girl with her back injury, and they've been putting her through months of therapy, but they're trying to strengthen these muscles. But they won't get strong. Why? They're trying to change the bulb. But the problem's the wiring. I made one change in the wiring, changed the software, and she had more strength than she'd been doing in months of therapy. Why? Changed the wiring. Flipped on the switch. Relief, get pressure off the nerves, you start getting signals so it doesn't hurt as much. Correction, follow through, keep the thing dynamically in place. You got to stay after it. Over that 12-week period, the appropriate amount to keep it in proper position so that it heals fully. And then restore the movement, and then you come into the third phase of strengthening. Now you can go to your weight training and your rehabilitative exercise and get payoff. That's correct sequence. Flip the sequence, it's incorrect, you won't get the result. And you get these people, they're all torn up, and they send them to physical therapy. They're doing all this exercise and saying, oh, I hurt so bad from that. Wasn't the right thing at the right time. Wrong thing, wrong time. I should mention adrenals if we're going to talk about extremity injuries. They're so important. We cover them in detail in our gland and blood sugar seminars. The adrenal glands that sit on top of your kidneys produce your anti-inflammatory hormones, your cortisone hormones. If you stress out your blood sugar system, if you blow out your adrenals, if you are stressed emotionally in all the various ways you can harm adrenals, not getting enough sleep, ongoing pain, whatever it is that stress them, you can have them underproducing the hormones that keep you out of pain. And now everything starts to hurt. Oh, it's my right ankle, it's my left shoulder, it's my back. And you feel like you're falling apart, and you feel like you're getting old. And what's a doctor going to do? Drugs. But are drugs going to fix your adrenals? No. At best, they'll leave them as bad as they are, but most of the time make them worse. They're not going to fix them.
No,
There's not a drug on the market. Oh, if they give you cortisone, you can count on the fact they're wrecking them. Read any medical book. It'll tell you it wrecks your adrenals to take cortisone. Most deadly drug. You want to get cortisone injected into your joints? Boy, last thing I'd ever allow. You want to go take a cortisone therapy and start taking 30, 40, 50 milligrams a day because you're in pain? Not unless you want to stay in pain and ruin your health. Cortisone's a last-ditch resort in life-saving problems, should never be used for routine pain situations and injuries, shouldn't even be touched for that. It's so dangerous, so hard on your body. Let's talk about first aid. You get a brand new injury, what do? You apply ice. Do you apply heat? No. You apply ice. Ice it for how long? About a week. A week continuously? Never. For the spine, you'd ice about 20 minutes on with the ice and then a 40-minute break. For a wrist, maybe 10, 12 minutes on, 20, 30-minute break. What happens if you ice something too long? So you use ice because it constricts, shuts down blood flow, calms down pain a little, reduces fluid flow so those things aren't as swollen. But if you continue icing over long, you get a reverse effect. You actually get the nerves so stoned, they finally get so ice, they just go, whatever. And then instead of contracting to the pain, they just go, whatever. And all of a sudden, fluid floods into the area, swelling increases dramatically, and pain worsens. So you don't just keep icing. Ice and then a break. Some therapists will tell you alternate ice with some heat. You can do that too. But never just ice, leave it on there for 2 hours. Don't do it. And you wonder why it felt good at first, Doc, but somehow about the second hour it was killing me. It was throbbing so bad I thought I had to go shoot myself with heroin. Never felt so much pain. Yeah, that's right. That's over-icing it. Now when do you use heat? Chronic conditions. They've already been there over a week. Then you can start using heat to increase blood flow. Do ice and heat cure things? Do they do everything that we're talking about tonight? No way. But how many of these therapy places, you get in a car accident, what do? Put ice and heat on it, bill $100. Does that fix this stuff? When your neck's been sprained and your vertebrae out of place, and you got pinched nerves and the whole thing's healing with all the wrong curves and it's going to be screwed up the rest of your life and end up with a degenerated spine? And all that happened was the doctor and the lawyer each got their $5,000 and you were put on ice and heat and it all healed wrong? What a ripoff. That stuff's horrible. Because those are soft tissue injuries to the spine too. Same rules for healing apply to the spine as apply to these extremities we're talking about. Now you want to know first aid nutrition. We recommend in our survival kit you keep 3 nutrients at home. I always keep an unopened pack of these 3 nutrients. Why? They last for years. Just put them somewhere where they're not out on the windowsill in the sun. They're fine. They'll last for years. Ligaplex, Mintran, and Calamo. We gave you a copy of the neuromuscular trauma kit. You got someone that's in a new injury. Give them the Ligaplex, the Mintran, and the Calamo. You'll be amazed. They will kiss you. They will love you. So many people tell you, that stuff's miraculous, Doc. I feel so much better overnight or in a day. And they'll be much, much better off than all the drugs you give them. Because you see, all the drugs are is just spray paint. You're just spray painting over a problem so you can't perceive it. It's not fixing a problem. In fact, your anti-inflammatory drugs, if you read the research on them, you will find that the non-steroidal anti-inflammatory drugs that are the darling drugs of the medical profession now for pain and injury sabotage the healing of soft tissue, so that while you are covering up the pain, you are stopping the process of healing the torn up tissue that is the cause of the pain. What a price to pay for just covering up a symptom. But when you use nutrients that can reduce pain naturally while speeding the healing of the tissue that caused the pain, you're so far ahead, aren't you?
Yeah.
Way ahead.
These naproxen sodium in that category.
Absolutely. See, all these anti-inflammatories, the steroidal ones are deadly, but the non-steroidal ones sabotage the healing of the tissue that is the reason you're taking it in the first place, is to heal that tissue. You want to know some other good things? Take a person with new injury and swelling and give them Biozyme, an enzyme product. Have them take 3 of them or 4 of them 3 times a day on an empty stomach. Have them go into the bloodstream and munch up all that broken down cellular debris from a new sprain. Oh, you just micro-tore all these ligaments and there's all this cellular gook around your ankle or your elbow and now, or your knee, and it's swollen up like a football. And what does the doctor want to do? Dumb stuff. Oh my God, they'll talk you into sticking a needle in there and draining fluid out of your knee. That's how weird they are. And then it all comes back again. They go, oh well, needle that long. Huh. Stress me, wear my adrenals out just thinking about it. You know? I hate needles. But you take enzymes and you suck that material out of there by dissolving it and letting it move out through the lymph, and the swelling comes down like magic compared to these drugs and these drainage techniques they have in medicine. It's like night and day. Fabulous stuff. Enzymes. Don't keep those at home. They don't keep. See, the neuromuscular trauma kit will keep. But enzymes are a living material. They're very hard to buy. Don't think you can get them at every health food store and know what you're getting. You cannot. Only a few companies make good enzyme products. They have to be assayed. They have to be properly manufactured. Most companies' products do not work. And you have to have very strong enzymes, and you got to buy them from a place like us that turns them over all the time. It's like buying batteries. Don't buy it from a place where you blow the dust off the batteries because it's been sitting there for 7 years. You go to a place that turns them over all the time, and you get fresh ones. That's what you got to do with enzymes. Don't keep those at home, but you keep the neuromuscular trauma kit at home, because when someone gets hurt, boom, you put them right on it. And then you throw some ice on it. And then you pick up the phone and call us, and you get in as soon as possible to do what? Test where it really is damaged, straighten the thing out immediately. Get the enzymes going in there, suck that swelling down, line it up. Now that stuff you started, the neuromuscular trauma is in there, healing it properly. You know, we all want to be do-it-yourselfers. You know, we all want to be able to do everything ourselves, save the money, be self-reliant. Nothing wrong with that if it works. I'll tell you, I have a hard time doing chiropractic on myself. It's hard, you know. How am I gonna? It's just, you know, there are just certain things it pays to have a professional who can get to where he needs to get and do the right thing. Chiropractic's one of those. You know, when I need an adjustment, I go to a chiropractor. I have them here. I go to them here. Same place you go to them for. Go to them for an adjustment. But the thing is you know, we all want to be so self-reliant. Oh, I'll just take the enzymes, I'll just take the nutrients, it'll all be right. Yeah, it'll all heal right where it sits right now. But what if you got that one metatarsal bone that's out of place in your foot? See, here's what happens to a foot and an ankle. You drop these arch bones, one of these key arches drops, and then these long bones called the metatarsals go with them, and they drop down, and then one of these metatarsal heads starts banging into the floor. And a person has these for years, they'll come in here and there'll be a big old callus under one of the heads of these bones. It's just hard as a rock under one of them. The doctors are like, whatever. They don't understand the mechanics of this thing. This bone drops, that bone drops, one of these drop, or maybe 2, and they're hitting the floor faster than everything. So what does your body do? Oh, we'll just toughen it up. We'll just harden up the tissue under the head of that bone so that bone doesn't just grind right through your foot. And you got this big old callus under there, and you wonder why your foot hurts every time you take a step. It's an old sprain that nobody healed right. That's what it is. Then we got to move that thing back up. Set that arch back straight. Make you up some of these orthotics that I wear every day that fit in your shoes that support your arch so it can heal nicely. Or support it preventively so that when you walk, if you're on your feet all day, it's like I'm on my feet all day, I don't want to be in shoes that don't support my feet. But you can have us make up something that you can last for years, stick in any shoes you want, or turn them into the best shoe in the world. You know? Take an average shoe, turn it into a perfect shoe, because you can't even buy a shoe as good as you can put a nice set of leather orthotics that are custom made for your foot and slide them in any shoe. Now you got a perfect shoe. You know, it's really the shoe you should be standing on. Boy, I think we covered it. Oh, one other thing I should talk about. Dietary and nutritional deficiencies. Do you think that a person's nutritional deficiencies could have anything to do with their sports injuries and their extremity injuries and their injuries? You know, people come to me, and I remember Dr. Cooper years ago, before she decided to become a chiropractor, she brought me her uncle. And her uncle came in, he had 4 or 5, I think it was 5 herniated discs in his back. And the doctors were treating him for 5 different completely blown out discs. And I said to him what I say to anyone that comes in like this. I have people come to me, they're 30 years old, they got 4, 5, 6 blown out discs in their spine. They got blown out joints all over the place. And the doctors, what do? Usual jive. Drugs here, surgery there, da-da-da, you know, the usual stuff. I say, you know, there's a question you got to ask. How the heck did a guy like you blow out 5 low back discs? What were you doing? Do you lift pianos? Are you a teamster? The guy was a music conductor. He lifted a little baton. How could you blow out 5 discs? I don't know. I said, I bet your doctor's never asked you that. No. Guy wanted to kill himself, literally, wanted to commit suicide. So much pain. How can you blow out 5 discs? You got to ask your question, how can that happen? I'll tell you how it happens. How good is your white fiber tissue? How good are your ligaments? How good are your cartilage? How good are your soft tissues? Hey, they're as good as the nutrients that you sucked into that body that got through your digestive tract that got to build them. Musicians come in here, they want to live on pizza and beer, and they want to figure out why they got carpal tunnel syndrome. Nutrition plays a role in whether your joints are holding together or falling apart. So you got people, they got all this stuff falling apart, and they can't see any connection. The holistic idea I always tell you, you step on the tail of the cat, it's the other end that yowls at you. You got to remember this stuff's interconnected. Your nutrition isn't disconnected from these joints. So when somebody blows out 5, 6, 7 discs of their spine, they start looking like you, George, we got to ask a question, what's wrong? That he's on crutches, wearing braces, trying to make the VA hospital figure out how to deliver health care. What's wrong here? And the answer is simple. Something systemic is wrong here when things are blown out in the whole system. But the doctors think this way? They don't. Why? Because the N-word. It's a dirty word to them. They can't think nutrition. You've got to have raw materials to build these joints. And if it's not in your diet, where the heck is it going to come from? Nowhere. And if that tissue is a bunch of cheap, rundown tissue, what's it going to take to tear it up? Not a whole heck of a lot. So you wonder why some people fall apart. Mention something else. Carpal tunnel syndrome. You never want to hit things or land on things with your bent back wrist. You got people, they like to fix things like this. They bang stuff into the wall with the heel of their hand. I had a famous musician come in here once, a very creative jazz guy, very well known. You all know his name. And he comes up with cool ideas. He's going to play his piano in a different way. He opens up the piano and he starts banging the strings. Those are big strings inside a piano, by the way, with his heel of his hand. Gave himself carpal tunnel syndrome. A guy comes in here and he has carpal tunnel syndrome. He goes, I've seen the doctors. I did acupuncture. They've been doing therapy. They gave me splints. I've taken drugs. It's been 2 years. I can't play. I don't know. When did it start? 2 years ago. They come to the seminar and I say, don't do push-ups on your bent back wrist. See, you go and put your weight on your bent back wrist. But what if that tissue isn't strong that holds those carpal bones in that nice little U arch that keeps it from crunching a nerve? Squish, micro tear, compression. they come to the seminar and they go, Doc, that's so funny. I decided to get fit just before my carpal tunnel problems. I started doing 100 push-ups a day. You know, that's where it came from, isn't it? Well, I guess so, because that's what started just before it happened. You want to know how to do push-ups? You get a push-up bar. They sell them at all the gym stores. They're like $12. And they got the little legs on them, and they got a little handle with padding, and you hold them like this. You can do push-ups all day. I do sets of 25 and 50 push-ups on those all day long, but don't do it like this. I can't afford to have carpal tunnel syndrome. I don't want to take the chance to find out if my ligaments are strong enough to support all my body weight over and over again. What if it's the night after you didn't get good rest? You had a couple drinks or whatever, and you go and try to do 50 push-ups. You think you're stronger that morning? No, all it takes is one time to tear those ligaments. There you go. Then you got the job. See, you can tear ligaments and injure something in a millisecond. That happens like that. It's not really fair that you can rip stuff up in a second, but you don't repair it in a second. 12 good weeks putting it together in a healthy 18-year-old in good shape. How about if your adrenals are totally run down? Think it'll take 12 weeks? Add some. How about if your digestive system's so bad you can't even assimilate minerals because you've blown out your stomach and there's no more acid, da-da-da-da-da. Is it going to take you 12 weeks? Add some. See, so you've got to factor in these things. You want to deal with prevention? Let me tell you about prevention. So not only do you want to eat well, we cover that in our zone workshops where we tell you how to eat food properly. But it does pay to take some supplements when you're dealing with longevity. And when you look at people, as I do all the time, and what is one of the main things that makes people feel old? Pain. Stuff that doesn't work. Knees that don't work, hands that don't work, necks that don't work, shoulders that don't work. Now, if you wanted to have all that work for 100 years, what would you do? You'd take some nutrients on a regular basis because you didn't have a problem. That's called prevention, right? I've told you what kind of nutrients you would use when you did have a problem to repair it. Guess what? Use the same nutrients at a lower dosage for prevention. So I take a few Ligaplex and I take some Mintran every day. I don't take the amount I give you guys when you're in pain and injured unless I'm in pain and injured. If I sprain an ankle, I do it. But when I'm not, haven't hurt anything, I take that stuff. And very funny, I work out with a trainer. Right now he's training James Woods and Alec Baldwin. He's a good trainer. And he trains all these guys, and he keeps sending them to me broken. This one's got a bad shoulder, that one's got a bad neck, that one's got a hurt knee, that one's got a bad shoulder. And when I showed him the nutrients I was taking, he says, "You're cheating, Doc. You don't hurt enough when I train you." I said, "It's the nutrients." "Oh, you're cheating. You should hurt more." But now, a year later, I'm the only guy who hasn't been injured. And all this, now he's suddenly like, "Now what are those nutrients you take, Tom?" See, he's getting a little more interested now. Because he watches all these other guys bench press the same weight I am, and they hurt their shoulder, and they tear up a wrist. But I'm not tearing it up. What's the difference? Prevention. Way smarter, way less expensive, way more intelligent when you apply it sensibly to keeping yourself out of a problem than having to catch it after you got a big problem just to get back to level zero again. Just to catch up to even. You see? Well, I hope you had fun tonight. I think we pretty much covered this area of sports and extremity injuries very, very thoroughly. We've covered what makes up these parts of the body, what gets injured in them, how you detect those injuries, how you can way outclass the current diagnostic abilities of medicine for most of these injuries. At a fraction of the expense, you can figure out what needs to be fixed, how to fix it, where it needs to go, what it needs, and give it the right things and then heal it. And the proof's in the pudding. All these success stories around here are the proof of what goes on here. You talk to the patients, that's the proof of what goes on here. And to the degree that you can be intelligent, you know, I always have to applaud and admire you that come here on a Tuesday night. I know there's a million things you can do. That, you know, you can sit in front of the tube, you can zone out, there's a lot of things you can do. But I can tell you one thing I've learned in life. Knowledge is the most valuable thing. It always has been for me. See, and what you don't know in health is the thing that will hurt you. And most people who end up in health problems that don't resolve, unfortunately, are ignorant of what they needed to know. And they're paying the price of their ignorance. Some of them don't even have a clue they don't know what they need to know. And some of them are sure they know everything. That none of that really matters. What matters is that when you have good knowledge, you're in a far better position to get yourself well, keep yourself well, and prevent yourself from having problems. And that's what this seminar was about tonight. We covered some very important principles here, because one thing we covered tonight is the idea that the human body knows more about healing itself than doctors know, and it does. It has the power that made these bodies, and it is the same power that knows how to heal them. But it does like to have things where they belong, and it likes to have what it needs. If it reaches for the shelf and the stuff it needs isn't there in your blood, it can't do anything. It's not going to build strong ligaments if it's missing the manganese because you didn't have any, because it wasn't in your pizza, or it wasn't in your chicken. You know, if it wasn't there, it wasn't there. So it likes to have it. And it can't heal anything in a better position than the position it's in, because it doesn't have the ability to just go, oh, I think I'll straighten this knee and retwist this vertebra. So it doesn't know how to get straight. So it needs to have those basics, the interference out of the way, and it needs to have the proper things. And then you let life intelligence do what it does best. It knows how to heal. And then let it do the healing. Because no doctor ever heals these things. Certainly medical doctors don't heal these things. The human body has in it, in life and in life intelligence, the power that heals all things that heal. Hope you had fun tonight.
Yeah.
For those of you that have never been patients, we've given you some health passes, something we started just a couple of months ago. It's new here. And with them, we give away a series of introductory services, $150 in services that we never used to do before. So what that entitles you to, we've given you 2 of them, is you can come in here, go over what health questions, concerns, problems, diagnoses, whatever you have a screening examination of tests directed exactly to those problems you have questions about, to see if we can gain insight to what's really causing them, using these very high-tech testing methods that we have that get to the heart of things and find what's wrong. Receive a free x-ray picture if you need one and it's appropriate to the problem that you have, and then go over the results of those tests and x-rays and explain to you if we think that alternative healthcare and nutrition and chiropractic and alternative medicine have the right answers for you, and if so, what we would recommend. And we do that all in a very low-key way. I always explain to people, if it's something you want to do, and we think we should be doing it for you, we're happy to do it. If we don't think we should be doing it, and we don't think you're our kind of case, we'll let you know right off the bat. If we think it's something we can fix here and should fix here, we will tell you. And then we let you make up your own mind. We don't put pressure on anyone. It doesn't make sense to me to put pressure on anybody. And we certainly don't need to put pressure on anybody. It doesn't make sense. So those are there for you and for family or friends that you think would benefit from the kind of work that we do here. I think really every person needs to have a good chiropractor and a good nutritionist. Just some people don't know that. Everybody really does need that. They need to have someone who can understand their nerve system and see what accumulated problems they've developed in their structural system. They need someone who can make sense of their biochemistry and make sure they're getting the things they need. And some people just don't know that, but that is one of the more essential services that an individual could avail of himself